Welcome back. So, in lecture 2 we will continue with the typical features of language deficit in SLI patients, and also we will look at another disorder which is called Williams syndrome. So, let us move forward. We have discussed, we started with the features, the typical features of grammatical deficit. The most notable of them is the inflectional categories, inflectional deficits with respect to tense marking and other kinds of structures, grammatical structures. So, let us start. Inflectional feature deficit is one of the most significant aspects. So, one of the interesting domains is the use of the optional infinitives. Often they use the infinitives because the inflectional marking is difficult for them, inflectional marking is often also absent. So, they tend to use more of the optional infinitives in structures where they are actually supposed to use the inflectional markers for tense and for other kind of markings. So, for example, this is an example from French, a French speaking child. So, here they are talking about the little baby sleeping. So, the sleeping is missing. So, the sleep, the to sleep, the infinitive verb, infinitive part of the verb is mentioned here, to sleep little baby. So, little baby wants to sleep or little baby is sleeping. So, those inflectional markings are missing. Similarly, another boy in English speaking child, I think it is a girl, Eve. So, she says Cromer wear glasses. So, wears the S marking is missing. So, that is what we mean by the inflectional features deficit. So, there have been many studies on this. One particular study compared the SLI children with aged between 4.4 and 5.8 years. They compared them with control groups. The study looked at the comparison between SLI children and with age matched control groups on morphemes marking tense, third person singular present and past tense ed, alongside auxiliaries be and do and various forms of other verbs. So, these were the categories on which the children were studied, the children were compared, SLI children, and they were compared with age matched and language matched control groups. So, this is a graph that the study presents. This is the age matched group, their performance. This is the language matched group and this is the SLI group. So, as you can see, the difference in performance between the age matched and the SLI group is very high. Language matched is when they have the language matched, but maybe not age matched. So, they are somewhere in between, but the difference between this and this is quite striking, and this difference persists in all the grammatical cases, on all the parameters on which they studied. So, the marking S as in the third person singular marker in English language, similarly the past tense marker ed, then the verb to be and the verb to do. In all these cases, the SLI children's performance was well below par along when compared with the age matched control. So, that is how what is the degree of the deficiency in these children. Then we will look at agreement relations. So, many scholars have pointed out that SLI children have trouble with ability to mark agreement in an otherwise normal grammar. So, the other things might be like normal structure, but agreement marking will be absent. So, agreement markers, what is agreement marker? It is a specific kind of a relation between the subject and the verb. For example, in case of Indian language, many Indian languages, you need to mention, your verb ending will show not only the tense and aspect, but it will also show the person marking. So, is it first person, is it second person, third person and so on. So, in case of first person, let us say I have to, if I am speaking, I have to say main ja rahi hu. So, that raha becomes rahi, and for a male it will become raha, ja raha hu, and like that. So, that is what we mean by agreement. So, the relationship between the verb and the subject on various parameters, it can be number, it can be gender, it can be person and so on and so forth. All of this will be marked. So, often these children will have trouble with agreement morphemes and inflectional morphemes, because agreement marking is what is difficult for these children. So, these morphemes will be either omitted or they will be wrongly placed. So, a study on German children showed that they have good control over plural and past participle morphology, but not agreement morphemes like third person auxiliary. That is why many researchers have talked about specific grammatical deficits in case of SLI children. So, in this particular study, the German study, the plural and past markings were fine, unlike the previous study that you just saw, the English children, but in this case the agreement morphemes were missing. Agreement morphemes they had problem with the agreement morpheme like third person auxiliary. Another study on Greek child aged 5.5 years also reports similar things. So, Greek has a very rich agreement system and uses 6-way distinction in person when combining them with other factors and case. So, you can imagine the complexity. So, there are 6-way distinction in the in person marking. The child, this particular child that was studied used agreement markers incorrectly, mostly in second person singular and second person plural with 78% and 97% error rate. That is the level of difficulty the child faced. Other agreement morphemes were correct 90% of the time. So, very specific grammatical categories that are getting affected in each of these cases. So, in the case of English children, more categories, in the German some others, in the case of the Greek child some other areas were affected. However, contrasting evidence is also found in another language with rich morphological agreement system, which is Italian. Another study that showed that this also has a very complex grammatical system, complex and rich morphological system, but in this case the children were not having that similar kind of problem. So, SLI child age 6.2 till 13.5 years over a period of time was studied longitudinally. This child was found to use all the forms of agreement patterns correctly with mere 3% error rate. So, the contradicting evidence also exists, that is the finding. Hence, this child who was diagnosed with SLI did not show the deficit of computing ability in case of complex agreement patterns. However, because the generalizability is one issue with this kind of findings. This particular study found a case where their child had no issues, but we cannot really say, we cannot generalize beyond a point, but we are just presenting the cases as they are. So, in some cases we have seen serious deficit, in some cases very less error rate. Structure dependent relations deficit, that is another area that we had marked. So, subject agreement relation is one such relation. So, other cases will be binding. Binding principles are an important part of syntactic understanding, syntactic processing in children and adults alike. So, binding principles govern the syntactic relation between reflexives, pronouns and their antecedents. So, reflexives must be bound in some local domain, while pronouns must be free in the same local domain, right. Thus, reflexives and pronouns cannot be treated in the same way while interpreting a sentence. Let us see some examples. So, this was a rather well known study, sentence and picture matching task. It was by Vanderlely and Stolwerk 1997. So, children were SLI children, age range was 9.3 to 12 years. The task was picture and sentence and picture matching. So, the sentence was Mowgli is tickling himself. Now, the pictures were, one picture showed Mowgli tickling himself. So, this is a match condition as in the sentence and the picture are exactly the same thing. So, whatever the sentence says, the picture depicts it, that is called a match condition. So, in this case they gave the correct responses, they could match them properly. And the other condition was the mismatch condition, in which case it showed Mowgli tickling Baloo bear. So, this is a mismatch condition. So, in this case also they could correctly respond that this is not a mismatch, it does not they do not match, this picture does not match with the sentence. Then comes a complex sentence, Baloo bear says Mowgli is tickling himself. Now, in this case this himself has to agree with Mowgli, because this is the local domain, that is what the theory says. In the local domain the reflexive has to agree with the subject in the local domain. So, in this case when Balu Bear says Mowgli is tickling himself, the person getting tickled is Mowgli. Now, the pictures had 3 types: Mowgli tickling himself, which is the matched condition, and the children responded correctly to this matching. Another picture, Mowgli tickling Balu Bear, this is a mismatch condition, this also they responded correctly. Balu Bear tickling himself, now this was also a mismatched condition, but here the response was mostly incorrect. Why? Because the in this case Balu Bear is tickling himself. So, what is happening here is this himself, these children, the subjects, the SLI patients connected this, they interpreted this himself with Balu Bear. So, not only in case of, so they are not obeying the binding principle here. Binding principle says that himself has to, the reflexive has to attach to the, it has to be interpreted as within the local domain. So, they were considering this also correct, this also correct. So, the response was this is a mismatch condition, but they as a result of which, because they thought this also matches the sentence, which was an incorrect response. So, this is how they showed that this particular study showed that they have a problem in this particular domain, which is sentence picture matching in case of complex sentences. So, the results were justified as an inability of the children to obey the binding principle, that is they could not compute the binding domain of the reflexive, hence the performance was at a chance level. So, whatever they thought, no, it might be, they just took chances. This is the reflexive. Now, let us look at the case of pronouns. Sentence, Mowgli is tickling him. Pictures, Mowgli is tickling Balu Bear, which is the match condition. So, they got it all correct. Mowgli is tickling himself, which is a mismatch condition. Less number of correct responses were found. So, the idea was, justification here was, the explanation that was given was probably because they take the pronoun to be anaphorically connected to the local antecedent. So, they had less number of correct responses in this case. So, complex sentence again using the same pronoun, Balu Bear says that Mowgli is tickling him, pictures whereas Mowgli tickling Balu Bear, which is the correct one, and we have Mowgli tickles himself, which again they performed on chance level. So, this is another domain. So, grammar lacking in inflectional features, now we will look at that. SLI reflects an inability to construct a normal grammar in the sense that they cannot abstract the rules governing the surface forms. That is the argument on the basis of which this has been proposed. That the reason why they do not get it, the reason why they sometimes make mistakes in case of inflectional morphology is because they do not understand the rule. They are simply looking at the things, looking at the sentences as in isolation, the words in isolation, not as a part of a rule governed phenomena. So, for them each word appears in isolation and needs to be committed to memory through rote learning. They are not following a rule, they are just memorizing this, as a result of which they make mistakes. So, a series of experiments were done that included Canadian and British English, Greek, Japanese and Quebec French. They used various tasks, both written and oral formats, covered both comprehension and production, spontaneous and elicited. So, it was a rather wide ranging study, and they showed that linguistic representation in SLI children do not include the inflectional features of plus minus plural and plus minus past. So, wherever the plural marking and the tense marking needs inflectional morphology to be utilized, that is when they do not perform very well. So, the idea as a result of which that was given was that they do not have this grammatical representation or linguistic representation, do not include this information. For example, so walks, walked, houses are not derived by a rule governed phenomena like stem plus inflectional morpheme, rather each of these words were separate. So, walk, walks, walked, walking, all of these will be considered as separate words, and because of this the cognitive load gets higher. Since you are not following a rule, you are simply memorizing everything. So, if you are committing things to memory, obviously you will need to utilize more cognitive resources, and that is where the problem lies according to this particular idea. if you are memorizing them as unanalyzed chunks rather than as will govern behavior. So, there this as a result of which it will show frequency effects. If you are just memorizing them, then this will happen. Frequency will have an effect, difficulty with inflection of novel words and incorrect segmental and prosodic features of the inflected word, because you are memorizing them all of them separately. So, these features will be visible in this kind of a case. So, processing deficit is a problem here. So, they will also have problem difficulty with functional morphemes like past tense plural marker as we have just seen, and the idea with which this is explained is the called surface hypothesis. Surface hypothesis says that these markers are particularly difficult because they are non-salient owing to their acoustic properties. Remember, we talked about the various kinds of acoustic and prosodic properties on the basis of which segmentation of sounds also happens. So, this is this seems to be a recurring issue. In this in case of SLI also, the processing difficulty arises because these features are non-salient, they are below the radar, so to say. So, the usually difficulty is seen when these are having shorter duration morpheme, they lack stress, are non-syllabic, subject to deletion in production and occurs in do not occur in final position. So, if these are cases, then that is when you find them having an issue with producing them. So, why is lack of salience a problem? According to this theory, it is not duration per se that is a problem, but the perception of a non-salient feature basically exhausts the cognitive resources, as I was just explaining. So, this is what prevents them from identifying the grammatical function of these morphemes and thereby placing them in a paradigm. So, in short, inflection's function is what they cannot process, which is at the heart of the problem. Why is that inflection utilized at all? Why do you use ing? Why do you use s or ed for to signal certain kind of grammatical function, certain kind of semantic information? That rule is not understood. As a result of which surface hypothesis says that they are looking at it only at the surface level. As a result of which memorizing them as chunks, as words only, not connected. That is the idea. So, the evidence comes from various studies, so from various languages as well. So, English, Italian and Hebrew speakers with SLI, these studies have looked at these different languages. English learners omit a range of grammatical morphemes like the copula, the article, plural and tense marking, which we have already seen. In contrast, Italian and Hebrew speaking SLI children had no problem with inflections on nouns and verbs and were found to use this morpheme accurately as their non-SLI counterparts. So, whereas English speaking children have a serious difficulty with inflections of various types, these children did not have. Italian and Hebrew did not have. Now, why did they not have the problem? The reason is in these languages these morphemes are salient, they are often final and often syllabic. So, how are they made salient? They occur in the final position and they are often syllabic. So, as a result of which you will notice them, they become a salient part of the sentence structure. So, because of their salience, Italian grammatical morphemes are not difficult to perceive, and as a result of which they can produce them. Hence, the processing resources of the children are suffice to incorporate them into the paradigm. However, investigation of Italian and French speaking SLI children show an asymmetry. Articles and clitics are homophones in these languages. So, if salience is the factor, then both of these should be equally weak in their speech. That was the hypothesis. But some studies reported an advantage of article over clitics in case of French children and the reverse in case of Italian children. Of course, this asymmetry we do not yet understand this, why it is happening. So, salience at least is not what is the important factor here, something else is happening. So, we are still not we do not really understand what is happening, but studies are going on various other languages as well. But these are the most important findings so far. So, in SLI we have seen that this is a specific language disorder In this disorder, there is no cognitive deficits or any physical or emotional or other kind of deficit. Certain kinds of grammatical domains get affected, and but then that deficit also is not universal. Some languages show a greater degree of deficit, some languages show a lesser degree. This has been explained with the idea of salience, placing it within the surface hypothesis, but that also has various kinds of studies that have not agreed with that hypothesis because the results are not conclusive. That is where we leave SLI. Now, we move on to Williams syndrome. Williams syndrome is the opposite of SLI in some senses, because in SLI the cognitive features are intact, language is affected. In Williams syndrome is the opposite. In this disorder, cognitive abilities are disrupted while language ability is more or less intact. The etiology of Williams syndrome is clearer than SLI. This disorder, also called infantile hypercalcemia, is a rare metabolic disorder that affects the calcium and calcitonin metabolism. So, this is a rare disease, it is also called hypercalcemia, and this affects the calcium and calcitonin metabolism in the body. So, this leads to a cognitive disorder, but linguistic abilities remain more or less intact. So, features of this disorder include these things: mental retardation, elfin facial appearance, several medical anomalies including supravalvular aortic stenosis. This is a congenital heart disease, heart defect, where the large blood vessel carrying blood from heart to the rest of the body is narrowed, and so on. So, this is in case of Williams syndrome, it is not just a cognitive disorder, but also has many other physical problems as well. So, it is a biomedical condition that affects body and the cognitive disorder and the cognitive abilities at the same time. So, there are serious intellectual limitations. So, this is a typical Williams syndrome face. This is what is called an elfin face. So, the puffiness around the eyes, and then blue eyes with starry pattern, then long upper lip length, all of that. Small and widely placed teeth. So, this is a typical facial feature of Williams syndrome. Williams syndrome also comes with very serious intellectual limitations, trouble with many of the Piagetian cognitive tasks like seriation task, conservation task. We talked about conservation task before. Seriation task is arranging, when every child, when in the beginning of their education, so to say, they are taught to arrange things in an order, either ascending order, descending order, or various kinds of other seriation. So, this is called seriation task. So, these children suffering from Williams syndrome will have serious problem with all these Piagetian tasks like seriation and conservation task, are weak in problem solving, and even in case of some everyday activities they will struggle. So, there are various kinds of disabilities and problems with Williams syndrome. Children personality, they typically have very talkative and friendly personality, often called the cocktail party personality. They are poor at drawing and often show lack of integration of parts of an object. So, if you ask them to draw something, it is not that they do not understand, they do not know, but they cannot they can explain the thing, but they cannot put them together. So, the bigger picture is missing. So, because of a visuospatial defect. So, this is how they will draw a cycle. This is how they have one particular patient 9 years 7 months, and this is 12 years 11 months. So, when you ask them to draw a cycle, this is what they produced. So, it is not like if you ask them what is a cycle, they will explain it, what are the parts and what are the function, but because of a visuospatial defect, they cannot put them together as one whole. So, that is Williams syndrome. Now, the tasks, Piagetian task for developing children. So, seriation task test the child's ability to organize objects as per one dimension. It could be length, it could be height, weight, and so on. So, arranging numbers in ascending, descending order, and so on, as I was just saying. Seriation task, on the other hand, is a logical thinking ability. Being able to conserve means knowing that a quantity does not change if it has been altered by being stretched, cut, elongated, spread out, shrunk, poured, whatever. So, the continuity of the object will remain constant. There are 7 types of periodization conservation tasks, generally tend to be acquired in this order. So, they will, there is an order through which they understand, they typically tend to develop this. So, starting with number acquired by age 6 and then followed by length, liquid, mass, area, weight and volume. Volume, the last one which is volume, typically is acquired by the time the children are at 10 years of age. Now, in stark contrast with their non-verbal tasks, the language of these children is generally less affected and is better than other populations with similar mental retardation like Down syndrome. So, their language abilities remain almost unaffected, quite good actually, and it is better than many other patients in the similar kind of bracket. Some scholars have argued that language abilities are not entirely intact, but in some cases of course there are some deformities, some deficits in some patients, but largely in case of Williams syndrome they remain, the language abilities are okay, they are good. Nonetheless, the dissociation between language and other mental functions in these patients have suggested modularity of language in the human brain. So, on the one hand we have our SLI, which is specific language impairment, on the other hand we have Williams syndrome. So, Williams syndrome is a very severe kind of cognitive disorder where simple daily everyday activities also get affected, visuospatial acuity will be affected, various kinds of periodization tasks they will not be successful in in doing. Similarly, many others. So, alongside many other physical deformities as well. However, in spite of having so many of the issues, the language abilities are more or less intact, in fact better than many other similar kind of population like Down syndrome. So, because of these two important disorders which seem to have separate trajectory of development, not affecting each other, not affecting cognitive deficit, not affecting language, and language not affecting cognitive deficit. Because of this, the idea has been proposed that modularity of the human brain has been proposed, and these two disorders have been used as proof, as justification for giving the modularity hypothesis. So, word acquisition, in the domain of word acquisition, the lexicon of these children is unusual for children for their normal age. In a study by Claassen, this is quite an important study with children with Williams syndrome ages 11, 12, 13 and 15, they obtained scores above their mental age in the one of the test batteries, the British picture vocabulary test. They also enjoy using low frequency words and know their meaning very well. Not only they have a higher vocabulary size, but they also enjoy using unusual words, often which is higher than their mental age matched peers. In a study by Bellugi et al. 1993, children aged 11, 13 and 16 could match words like canine, archaeologist and cornea with correct ones from among 4 pictures. These are not high frequency words, these are very uncommon words and difficult words, but they could do well on this. This could explain they could explain the word meanings using long definitions, like they knew how to use them in a context appropriate way. There are very interesting studies on this as to how they describe in a vivid way. If you ask them any question, for example, the definitions sometimes are peculiar, but almost Sheldon like. So, for example, in one case somebody says sad is when someone dies, someone is hurt, like when you cry. Another, sad is when you lost somebody that you love and care about, it means something happens to you like your grandmother died. I wish I could surrender, that means I give up. I would like to commentate it, it means that like all the sportscasters do, they tell who is doing what. For their age, their linguistic, the language production, linguistic output is quite mature and often quite noteworthy in terms of their age matched controls. This is typical of Williams syndrome. Inflectional morphology, because we have checked inflectional morphology with SLI, unlike children with SLI, children with WS use a number of inflectional morphology correctly. Even though they start to speak late, their mastery over inflectional morphology is better, as shown by various studies, again by the same group, Klassen and Almazen group. Typical comparison between SLI and WS with their age matched and language matched controls show that WS children have adult accuracy in language, even though their cognitive abilities are lower than the other groups. Thus, even when Williams syndrome and SLI children have comparable language development in terms of MLU mean language length of utterance, MLU is mean length of utterance. So, in terms of MLU, they will have some amount of, they can be comparable. The latter show significant lack of understanding of tense marking, which the WS children do not show. So, in terms of the length of utterances, they can be comparable sometimes. However, the inflection, which is a serious problem with SLI children, is not seen with the Williams syndrome children. Another study showed the WS children had no problem with inflecting regular existing and nouns verbs, whereas matched SLI children achieved lower scores. Every day I spling around London, it has no meaning, this is a nonsense word, non-word. So, just like everybody, yesterday I dash around London. So, basically here it could be they could have used the ed marked. So, ed is the inflectional morpheme for past tense marking in English language. This was the task. So, first they gave the regular form, the root form, I spling around London, and then yesterday I splinged around London. However, WS individuals did not do very well in production of irregular verbs and tended to overgeneralize. So, here is the main difference between these two groups is that SLI children fail to use past tense morpheme, thereby using only the base forms. On the other hand, WS children did use past morpheme but overgeneralize them. Syntactic structure: children with Williams syndrome display good comprehension and production of syntactic structure. So, for example, structures like reversible passives, conditionals, relative clauses and comparatives, in all these cases they do pretty well. These are some examples. Similarly, it has also been seen that these children perform really well in all types of passives. Passives are a difficult domain. We have seen it while looking at syntax, that children take time to learn passives, and we also have language cross language differences in terms of at what age they learn it. In case of WS children, they do pretty well. So, reversible verbal passive, the teddy is mended by the girl. This kind of cases they do well. By contrast, children with SLI whose chronological age matched with the mental age of the WS children, they perform poorly on this kind of passives. So, unaffected controls also made some errors in some cases. So, because these are difficult constructions in the first place, but WS children seem to do pretty well. Again, children with WS, when tested on principles of binding theory, we have looked at binding theory in case of SLI. So, the same has also been tested on these children, but they have been found to performing on ceiling level, that is performing at the highest level given the variable. So, they have done optimally well. This was in contrast with the performance of the SLI children. Again, they even perform better than children without Williams syndrome in the matched in mental age. These are some of the proofs of their abilities of language related functions, language related processing, that shows that Williams syndrome children typically tend to do a lot better than SLI children on various grammatical domains like passive construction, like inflectional morphology and so on. And even sometimes they do better than the control group as well, the non-affected children. So, these are the two cases that have that are often used as examples of modularity. and this is where we will stop with these cases. In the next lecture, we will look at, we will start with some cases where both language as well as cognitive deficits are seen. So, kind of a comorbidity where you see language deficits as well as cognitive deficits and otherwise. So, those are the other types of cases that we talked about, and in this segment we talked about the separate cases where language disorder and cognitive disorder do not match. Thank you.